My name is Brianna France, and my drug class is bisphosphonates. So just to recap, bones go through a constant process of rebuilding by osteoblasts and resorption by osteoclasts. As we get older, this process becomes imbalanced. Bone is being broken down faster than it can be built. This is a major concern for postmenopausal women. Other conditions, such as cancer and Paget's disease, can also alter this process. This is when bisphosphonates come into play. Drugs included in this category are Fosamax, Actonil, Iridia, Bonivia, and Diadronil. Bisphosphonates adhere tightly to the bone, inhibit osteoclastic activity and bone resorption, and therefore increase bone density. Bisphosphonates should be taken first thing in the morning on an empty stomach with 8 ounces of plain water. Food and other beverages decrease the absorption of these drugs. The drug is then distributed to the bone. There is no proof that these drugs are systemically metabolized. Amounts of the drug that are not distributed are excreted in the urine. Use cautiously in those with GI disorders. There are no absolute contraindications except for untreated hypocalcemia, Barrett's esophagus, and renal insufficiency. GI upset, dyspepsia, and musculoskeletal pain are the most common side effects. All bisphosphonates can cause esophagitis. A rare side effect from these drugs include osteonecrosis of the jaw. Drug interactions for this category include drugs that affect the GI tract, histamine 2 blocking agents, calcium supplements, and antacids interfere with the absorption of bisphosphonates. Aspirin and NSAIDs increase risk of GI bleeding. Bisphosphonates are used to prevent and treat osteoporosis, especially in postmenopausal women. They are also used for Paget's disease and heterotopic ossification. Before beginning treatment with bisphosphonates, rule out common treatable disorders that can also cause low bone density, such as hyperparathyroidism, vitamin D deficiency, hyperthyroidism, and renal disease. We are going to monitor the serum calcium, phosphate, magnesium, and potassium. Alkaline phosphate is a major indicator of Paget's disease, and reduction in the alkaline phosphate is the indicator of efficacy. We also are going to monitor bone mineral density using the dual energy X-ray absorptiometry. Teach our patients that these drugs must be taken first thing in the morning on an empty stomach at least 30 to 60 minutes before other meds, food, or drink. These drugs must be taken with 8 ounces of plain water. Anything else will greatly reduce the absorption of these drugs. They must take bisphosphonates 1 hour before antacids or supplemental calcium. Patients also must remain upright for at least 30 minutes after taking the drug. We're also going to teach them about having a balanced diet with adequate amounts of calcium and vitamin D. We're going to teach them that supplemental calcium and vitamin D are usually needed. We should also promote regular exercise, smoking cessation, and alcohol cessation. And then we're going to tell them that follow-up appointments are very important. So remember, before prescribing bisphosphonates, rule out other causes of low bone density. Instruct your patient to take these medicines first thing in the morning with 8 ounces of plain water. Patients must remain upright after administration, and teach them that GI upset and musculoskeletal pain are common symptoms of these drugs.